What's up, guys? Study times here. In this video, we're going to talk about diabetes. If you like the video, please like and subscribe and turn on the notification bell so you don't miss any of our uploads. Let's dig into it. First, we're going to talk about pathology and the causes of diabetes. So, what is diabetes? It's a group of chronic disorders, and the characteristic is abnormal glucose metabolism, and it results is the elevation in the blood glucose. So, what are the causes? It can be genetic, or it can be related to your lifestyle. What are the complications? It can happen that you have hyper or hypoglycemia. Hyper means higher, hypo means lower. Glycemia is like glucose. Amia is like in the blood, so higher or lower level of glucose in the blood. Diabetic ketoacidosis. We are going to talk about more deeply, but because your body doesn't have enough amount of glucose, so as a source of energy, the liver produces ketone bodies for the other tissues. So the other tissues use the ketone bodies to produce the energy. But the problem is ketone bodies make the blood acidic. So that's why it's called diabetic ketoacidosis. Hyperglycemic state, or HHS. What is it? It's a complication of diabetes, as you can see here, in which the high blood sugar results in high osmolarity in your blood. But the point is, it's not related to ketoacidosis. So when you are in the HHS, so you don't have a ketoacidosis, but you have high osmolarity in the blood because a lot of sugar is in your blood. Vascular and neurological pathology, because of higher sugar, higher glucose, the vessels and the neurons cannot work properly. And the renal diseases, exactly because of the higher amount of glucose. Signs and symptoms, it's symptomatic hyperglycemia. So, diagnosis. How do we diagnose the diabetes? So, we have lab results from urine. You can because you have a lot of glucose in the blood. Some of the glucose goes into the urine. Normally, you don't have any glucose in the urine, but because in diabetes, it's a lot of glucose in the urine in the blood. They go to the urine, so you can have a glycosuria. It means glucose in the urine, or albuminuria. Why this happens? This happens albuminuria or proteinuria. This happens because it can happen because higher glucose in the blood can damage the kidneys, and the kidneys are not working properly. So you can have a protein in urine as well. Usually, you don't have protein in the urine, but in diabetes, you usually have it. Blood tests, you can have non-fasting or fasting glucose tests. So it just measures the glucose levels. And hemoglobin A1C, what is this? Hemoglobin A1C test. It measures the okay, the amount of glucose or sugar attached to the hemoglobin. When you have glucose in the blood and it's a lot, some of them get attached to hemoglobin. And this test, hemoglobin A1C, measures that. So you have an increased amount of glucose or sugar attached to hemoglobin. Diabetic ketoacidosis, it happens when the glucose level is more than 250 milligrams per deciliter. And hyperosmolar hyperglycemic state, or HHS, it develops when the glucose level is higher than 600 milligrams per deciliter. Other diagnostics, you can undergo some physical examination. One of the tests is a fundoscopic exam. What is it? It's when they look at the retina. As you can see here, this is the retina of a diabetic patient. So if you look at the retina, you can see some cotton wool spot, as you can see here. It's not normally a normal patient. And you can see some hemorrhages. Another test is a monofilament testing, and it's like with one filament, they put it onto some spots on food, as you can see here, and the patient with diabetes cannot feel it properly. So the sensation is less than a normal person. In diabetic patients, the vessels and nerves are cannot work properly because there are a lot of glucose. So that's why the patient cannot feel these spots properly. And in the lower extremities, pedal pulses are lower because the vessels cannot work properly, so the blood cannot go to lower extremities because it's so far from heart, so the blood pressure is lower and the vessels are not working properly, so the blood flow to lower extremities is not that perfect. So that's why the pulses in the feet are less, and that's why the people with diabetes, they usually not usually, sometimes, okay, most of the times, they have also ulcers in the lower extremities. About treatment, medications. So it depends on what type of diabetes we have. If it's diabetes type 1, they inject some insulin to the patient. And if it's diabetes type 2, they can inject some insulin and oral anti-diabetic agents. Uh, or other interventions in can be weight loss or exercise or healthy lifestyle, and smoking cessation and metabolism regulation with diet. So simply healthy food. So we're going to talk about different diabetes, different types of diabetes in different videos. That's going to be it for this video. See you in the next one. Bye.